Welcome everyone to lecture on digital safety and cybersecurity in healthcare. My name is Tiina Blake and I will be guiding you through the critical aspects of maintaining cybersecurity in healthcare settings. This presentation is based on the work of mine and Jaana Mäkelä from JAMK University of Applied Sciences. As we all know, healthcare worldwide is increasingly dependent on information systems with the use of connected medical devices, cloud storage services, and network systems on the rise. However, this dependency also makes them vulnerable to cyber attacks. It is estimated that around half of cyber attacks are caused by employees' actions such as carelessness, rush, and lack of knowledge. In 2023, there was an average of 1,600 cyber attacks per week on healthcare systems globally. It was an 11% increase from the previous year. The healthcare sector is particularly vulnerable, with 1 in 25 organizations affected by ransomware attacks. On this next slide, you can see the number of ransomware attacks on different sectors and the change of amount in the years 2022 and 2023. Healthcare information systems are considered as soft targets for criminals. Our systems are of interest due to the sensitive and valuable nature of patient data. Factors such as outdated technology, a large number of devices, and insufficient employee knowledge about risks contribute to this vulnerability. Common cyber threats in healthcare include data breaches, leaked usernames, denial of service attacks, ransomware, and supply chain attacks. For more information on these types of attacks, see the self-study material within this module. But there is also cyber attacks on medical devices. All networked devices are potential gateways for cyber attacks, with around half of the connected medical devices having known critical vulnerabilities. Medical devices that are vulnerable to cyber attacks include, for example, insulin pumps, pacemakers, and infusion pumps for pain management. You can read more about these vulnerabilities from this article mentioned in the bottom of the slide. In this slide, we have a notable case from the USA involved 12 hospitals in 4 states being affected by a cyber attack, leading to patients being turned away from emergency rooms, cancelled procedures, and disabled information systems. You can see the news flash by clicking the picture here on the slide. The median cost of a major security incident in the health sector is around 300,000 euros. Cyber attacks pose a threat to patient care and safety, challenge the availability of healthcare services, and impact data confidentiality, integrity, and availability. The following 5 slides bring together the digital insecure practices of health professionals. These practices include password repetition, sharing user IDs, reliance on spam filters, downloading malware, using personal devices for work, and using open Wi-Fi. These behaviors increase the risk of cyber attacks. Read through these slides carefully while reflecting on your own practices and those of your colleagues or interns. See if you can find any examples that you have faced too. To ensure cybersecurity, employees should change default passwords and use strong passwords, as well as secure networks. We should always follow information security instructions and know how to respond to data system failures. Continuous development and maintenance of cybersecurity competence and awareness are crucial. Employees and managers are responsible for planning action models for exceptional situations and ensure that employees are aware of them. Definition of responsibilities are also important. For example, who is responsible of updating medical device systems? In conclusion, cybersecurity in healthcare is vital for protecting sensitive patient data and ensuring the smooth operation of healthcare services. By understanding the risks and implementing secure practices, we can mitigate the impact of cyber threats.